Madam Clerk, could you call the roll?
Yes, Mr. Chair. Commissioner Leitner? Here. Commissioner Walls? Here. Commissioner Rice?
Here.
Commissioner Duckham? Here. Commissioner Alexander? Commissioner Mahoney? Commissioner Polacek? Commissioner Elwell? Here. Chairman Shotwell?
Here.
We do have a quorum.
Good morning, everyone. I'd like to open up this presentation on our healthy communities of our strategic implementation team with a little icebreaker. So it's a quick little statistics game, if you will. So I'm going to need to pass out 10 cards. So if I don't have 10 folks, let's see, 3, 4, 5, 6, 7, 8, 9, 10. I think everybody's going to play this game. You too, Amanda.
I got it. Do you have it on your desktop already, or you have it on a thumb drive?
I do have a thumb drive, but I did send it over to Delane, so it should be booted up here.
Okay, well, I'm having a problem with the password, so I have to fix that.
Okay, I do have my flash drive if you'd like that, if it doesn't work.
I can fix the password really quick.
Okay, thank you. Maybe I'll go ahead with the game right before the presentation. If I can turn it. I'll go ahead with the icebreaker while we get the presentation up. Hello. Okay, so we're looking at statistics from our latest community health assessment in Jackson here. We're also going to be looking at some vital statistics data from MyFi, Behavioral Risk Factor Survey, Youth Risk Factor Survey as well. But the first piece that I'd like to do is to ask those of you with holding numbers 1 through 4, not yet, 1 through 4, if you'd hold your card up. Okay, so 4 out of 10 in Jackson County is our obesity rate. Also want to point out that only 1.5 people out of 4 out of 10 actually think they're obese. So there's a perception issue here, education issue. If we look at that 1 through 4, and then hold those up, and if 7 through 10 would also hold up your cards. I'm sorry, 5 through 7, 5 through 7. So now we have 7 cards up out of 10. That is the rate of individuals in our community that are overweight and obese together. So 30% overweight, 40% obese. Are you eating a donut, Mike, as I'm looking at you?
They don't go together?
Oh, yes, they do. So 7 out of 10 is our obesity and overweight rate. Thank you. Okay, now if numbers 8 through 10 would hold up their card, I want to involve everybody. So again, that's 3 out of 10 adult smokers in Jackson County. If we look at the city of Jackson, and if I were to have a 0.5 card, 3.5 out of 10 adults smoke in the city of Jackson. Thank you. Back to numbers 1 through 4. Get back there.
I've got a victim.
Uh-oh. He passed off his card to you. Okay, so we're playing a statistics game, a little icebreaker for my presentation here. So now we're looking at if numbers 1 through 4, again, would hold their cards. This is the adults in the county of Jackson who are exposed to secondhand smoke. If we take that a step further, and if number 5 also held up their cards, so 1 through 5, all right, in the city of Jackson, 50% of the adults are exposed to secondhand smoke in the city of Jackson. Thank you. Numbers 8 through 10. Numbers 8 through 10, if we look at those, sorry, I'm listening to my presentation here. We're talking about 3 out of 10 females in the city of Jackson will become pregnant at least once by age 20. So 30%, 3 out of 10. Thank you. And if card number 1, where 1 went, thank you. Almost 1 in 10 females, 15 through 19, in the city of Jackson gave birth in 2012. 1 out of 10. Thank you. And the city of Jackson has the highest teen birth rate among cities in Michigan with a population over 20,000. And then finally, cards 1 through 7, if you hold those high. Thank you. 7 infants died in 2012 in the county of Jackson. 7 infants. And that, if I break that ratio down, we have a disparity of 2.5 to 1 for African American babies to Caucasian. So of that 7, 5 African American babies would die and 2 Caucasian. So wanted to kind of warm you up to think about some of the data for our community as we move forward with the positive things of our community action plan. If I have a presentation, please. I do have a flash drive. Do we want to just... I have a backup plan.
Here we go.
I didn't bring paper. We talked about that, and we didn't think we needed that, so...
I need to minimize that. Get to your presentation, or is that part of it?
It's, actually, here's what. Grab the flash drive, okay. Well, I mean, that's fine too, if you guys have it and we ought to just follow along that way. Is that? Okay, I'm sorry. Go ahead, where do you put it in?
Yeah, right. Sorry about that.
That's okay. Stop it.
Is it the top one, the 2-2?
Oh, there it is, there it is. There it is. And how do I follow along? Where's my,
You want to do the slideshow?
yeah. Well, no, I mean, I'm going to click it as I go along.
Yeah, so you can do a slideshow from the beginning, and then you can either just use
Arrow
that.
down.
Yeah, depending on if the mouse was set up to.
Let's see if the arrow down works. Yes, okay.
Okay.
All right. I think we're all set. So I represent the healthy communities of the Jackson County Strategic Implementation Team, and I work and co-chair this with Dr. Amy Schultz from Allegiance Health, and together we make up what is our county's health improvement organization, of which we have a coordinating council, and we have 5 health action teams that do the work and the objectives and all the strategies for our team. So we have done a community health assessment, which has been a telephone survey, and we did one in 2008, 2011, and 2014. So what I'm sharing with you are the findings of 2014 and doing some comparative analysis of the previous 2 health assessments, and also looking at further objective and subjective criteria moving towards the next prioritization and update of our health action teams to make sure that we align with the data. Commissioner Deckham?
Not to be self-ingratiating or argumentative, but According to the doctor, I'm obese.
Are you talking about your body mass index? Yeah. Well, it is a formula, and, I mean, I have no idea your height and your weight, but the BMI is based on your height and your weight. I will say that individuals that are extremely very muscular, that sometimes that can skew that a little bit because muscle weighs more than fat. That's probably it.
Okay.
Okay. Good comeback, Shelley. Okay, so as we look at the data, on the dashboard, I just want to draw your attention to the fact that we have those with the blue star are new baseline data, and then indicators that had no change you'll see with the horizontal yellow arrow, and those with a positive change will be a green arrow pointing up, and indicators where we have a negative change will be the red arrow going down. So we have a community health assessment ad hoc work group, and we developed a set of indicators for our health assessment. We have a variety, as I said, of survey sources, not just the community health assessment data, but also, as I said, youth risk behavior surveys, kids count data, national citizen survey, behavioral risk factor surveys. The kind of the list goes on, but we made sure that we had data that was well documented. We administered the survey in May through August of 2014. It was contracted out. There were 177 questions, and we had 1,205 full complete surveys, and we also had to have a minimum of 30 fully complete surveys per each census tract. The data was then weighted, and we used the BRFS methodology to sort of normalize the data for the Jackson population data. So all things are equal when we're talking about results and looking at things such as the telephone source and race, ethnicity, education level, marital status, and all those specific indicators. So next, we had an ad hoc work group that met 2 to 3 times where we reviewed all the data and the indicators. We did additional analysis based on things that we thought were compelling data, things where we saw where there was statistically significant changes. We also looked at our county health rankings, and this is the population health studies that the University of Wisconsin puts this out, and I think they have now for about 4 or 5 years. And so we're looking at the ranking of Jackson County on 82 reported communities, and where we come as far as our overall health outcomes. And the final analysis really is our morbidity rates and our mortality rates. So mortality would be our years of life, and morbidity would be related to our quality of life. So as you can see, since 2010, Jackson has ranked from 65, and we've improved to 50. So those are some positive trends looking at that data. As you can see, just to break it down just a little bit more, looking at 2013 and 2014 with our health outcomes, we were 48th of 82 reported counties in 13, and we did, that is a decrease actually to 50th, because 1 being the best. Mortality rate and indicators stayed the same. Morbidity, we decreased by 1 by moving up to 61. And then looking at health factors, that's a compilation of a lot of indicators, specifically health behaviors. We were 73rd in 2013, and we did improve to 62nd. Those would be indicators that we'll be talking about today, such as smoking rates, obesity rates, excessive drinking, teen birth rates. Clinical care, we made a slight improvement there from 33 to 30, and that has a lot to do with access to health care, to primary care, dental care, mental health, insurance coverage, screenings, mammographies, socioeconomic. That's, as you might imagine, like our unemployment rate, the number of children in our community living in poverty, high school graduation rates, college degrees, and there we've made a decline as well from 41 to 46. And finally, the physical environment, and that's looking at such things as our housing conditions, our air and water quality, exposure to lead and radon, things of that nature, and we did improve in that category from 78 to 63. So now I'm just going to get into the specific objectives of our community, our health action teams. Yes, Commissioner Rice.
Thank you. Just a question on the improvements and such that you just mentioned. Are these all actual, is this factual data that we improved, or does this have anything to do with the fact that potentially other counties, their numbers got worse?
So it is a ranking from 1 to 82, and so perhaps, yes, we've improved, but we could also say that there would be a rejuggling of some of those counties based on if they improved or worsened. So it's just a juggling within the 82 reportable counties. So, but it is based on facts. There's indicators. There's a full report actually. If you Googled county health rankings, and it would show back for 4 or 5 years, and it's an awesome report because it looks at a multitude of indicators, and it really lays out a good picture. So I don't know if I fully answered your question, but I would encourage you to look at that a little bit more and kind of read the summaries and whatnot.
Okay, thank you.
Okay, so the first objectives are related to the goal of our community awareness and engagement health action team. Like I said, there's 5 health action teams that are championed by chairpersons that have specific tasks that they work on, year-round. So the first was to improve the knowledge, attitudes, and behaviors of Jackson County residents related to health and wellness. And you can see the community health assessment data for 2011 in this case, and then 2014. We have improved, we have not improved. So the red arrow pointing down, to increase by at least 10% the proportion of Jackson adults who understand the national guidelines for recommended physical activity. So we actually did not improve. We went from 12% to 10%. The next objective, we have data for 3 years, and again, we went from 69 to 73, and then back to 64%. So actually a little bit better, but overall, I'm looking at the data in reverse. It's a negative change. We went from 73 to 64% to increase by at least 10% the proportion of Jackson adults who have a positive perception of Jackson residents' access to opportunities for physical activity, such as, is it very easy to find a place to exercise? Well, only 64% of our population agreed with that. Prior to that, it was 73%, so it is a negative change. Still looking at that same goal in Objective 3, to increase by at least 10% the proportion of Jackson adults who have a positive perception of Jackson residents' access to opportunities for healthy eating. So again, a negative, only 79% of our population would agree with that. Prior year, it was 83%, so just a negative change. Percent of Jackson County residents that indicate their employer provides access to healthy foods at work. Again, it was 48% now to 44%. I would like to say that we are making some positive change there within Jackson County with our healthy vending. So. What do you? Okay. I won't look at the donuts over there for sure. Okay, Objective 1.4, to increase by at least 10% the proportion of Jackson adults who recognize the symptoms of depression. And there we had a positive trend. So we went from 66 to 71% of residents now reporting that they can recognize symptoms of depression. The next 2 goals, or I should say objectives, are new, so we just now have baseline data from this current survey, and we'll be moving forward with that. But to increase by 10% proportion of adults who identify community resources for behavioral health services. So 81% I'd say that looks pretty good. Also, the next one is that to establish a baseline increase by 10%, the proportion of Jackson adults who identify community resources for smoking cessation. The baseline there is 50%, or half of our population. So goal 2 is all focused on reducing the obesity rates. So our objectives will be related to improving nutrition and improving exercise, physical activity. So again, as I pointed out earlier, our obesity rate is at 40% according to our community health assessment data. And I did mention that our overweight rate is 30%, so that's for a total of 70%. So going in the wrong direction there. The next one, percent of Jackson County residents that received advice about their weight from a healthcare provider, and the number that reported yes. So we did have a slight increase there that went up to 42%. So we are having residents report that, you know, who do they value that kind of information from? And they say it is their healthcare provider. So truly, we need healthcare providers to be making sure that they're educating their patients in those short 15-minute visits about all things to improve their health. Percent of Jackson County residents that consider themselves to be obese, as I pointed out, only 15% of that 40% actually consider themselves to be obese. The next objective is to increase by 10% the average daily fruit and vegetable consumption among Jackson adults, and this is looking at our BRFS data. The question was the percent that reported yes as a response to eating 5 or more, and for that baseline data, only 10% of the population indicated that. The next one is to increase by 10% the proportion of Jackson middle and high school students who meet recommendations for fresh fruits and vegetable intake. And the MyFi data for 2014, we actually went down from 39% in 12 to 30% in 14. And again, we went down for high school students from 27% to 23%. Goal 2, again in the obesity category, we had a positive trend there. The portion of Jackson residents with low access to fresh foods, fruits and vegetables. Of the data reported, we actually in 2011, 19,000 residents reported that they had low access, and then that number decreased to 12,217 from this most current survey. The next specific 2.4 is to reduce by 10% the portion of enrolled children in our WIC, our Women, Infant, and Children program, with a BMI above 85%. And that number has actually gone in the wrong direction as well. We now went from 30% in 11 to 34% with the BMI in the 85th percentile, which is obese. So childhood obesity is another issue for our community. So objective 2.5, this is a new indicator. Jackson adults and middle and high school students meet the federal recommendations for physical activity. So of our adults, 28%, of our middle school, 66%, and of our high school, 59%. But you can see that there are positive trends there in the middle and high school data. 2.6, increase by 10% the quality and availability of physical activity opportunities in Jackson County. So we went from 73% to 64% on our community health assessment data that report that it is very easy to find a place to exercise. And then a rating of community recreational opportunities in Jackson County, there was no change, 48% in 11 and 48% in 14. The National Citizen Survey data on 2.7 increased by 10% the utilization of opportunities for physical activity in Jackson County. Some improved data there. Percent of Jackson County residents that used a rec center went from 50% 50% to 54%. Residents that participated in a recreation program or activity, that went from 40% to 54%, so that's a positive trend. Jackson County residents that visited a neighborhood or county park, unfortunately, that decreased from 85% to 75%. That is unfortunate because we do have some beautiful parks here in our county. Objective 2.7, let's see. So, starting to feel like I'm repeating some of these. Okay, 10%, increased by 10% the utilization of opportunities for physical activity in Jackson County. That we went in the wrong direction. Percent of Jackson County residents that use the walking trails have indicated on the survey at 24% from 32% in 11. And then that use the biking routes dropped from 30% to 17%. That's kind of saddening because we have some beautiful trails here. Let's see, goal 3, which is focused on smoke-free health action activities. And this is some of the information I shared right off the top. The percent of Jackson County adults that are smokers. For 2014 data, we have 30% in our county. Unfortunately, in the city, it's even higher. It's 35%. Proportion of students that report having smoked cigarettes, middle school, 2%, and high school, 11%. Those indicators improved from previous year. The next one is to decrease by 10% the portion of students that report having smoked cigarillos, cigars in the past 30 days. Improved data there from 2 to 1% for middle school and 8 to 7% for high school. The next one is to reduce the the proportion of smokers who report receiving advice from the provider. Like I was saying earlier, that's where people want to hear. They want to hear from their provider. So there's a positive trend that in 2011, 61% reported hearing that they needed to quit smoking, and then in 2014, it increased to 68%. And then again, more information on the secondhand smoke. Percent of adults exposed to secondhand smoke, we see that went up from 23% to 39%. I find that alarming with the Clean Indoor Air Act, but this is data from a community health assessment. And then percentages of students exposed to secondhand smoke during the past 7 days. We had some improved data there. So as you can see, 43% in middle school and 52% in high school, and those numbers have dropped. Let's see, now we are working with the behavioral health action team, and this, some of these data, so emotional wellness, mental health indicators. So the first objective, we've seen some positive trends there. 10%, to increase by 10%, the percent of adults who would definitely seek professional help for a serious emotional problem. And that improved from 54% to 63%. And then again, bullying ties right into behavioral health issues. We wanted to increase the percent of students, to decrease by 10%, the percent of students who have been bullied on school property. And in middle school, that decreased from 45 to 40, and then in high school, it decreased from 30 to 26%. So hopefully some good education in that category is making some improvements. Back to the mental health category, to increase by 10%, the percent of completed ages and stages questionnaire for children between the ages of 0 to 6, and that is an assessment of their social and emotional development for the very, very young. So that's a new baseline that you'll be receiving more information on in subsequent years, but that first set of data is not yet available. Objective 4.6, adults who report they usually or always get the social and emotional support they need. We had no change there from 11 to 14, so 74%. So the last few slides really are just other data that assesses our community beyond specific to our health action teams. And the teen pregnancy rate per 1,000 females here. I'm going to tell you right now that that data is in there incorrectly. 2012, it is exactly 53.3, so that's a change that needs to be made on this slide. But so the trend really, it has gone up. But I will say we have years that are anomalies, so we always have to look at trends. But the trend for teen pregnancy rates in Jackson is dropping overall. So we're very, very proud of that data and the work that's being done there. The infant mortality rate, and this is per 1,000 live births, that has improved from 6.0 to 3.9. And as I pointed out to you in raw numbers, that was 7 infant deaths for 2012 for our community. We want 0. The next slide is in regards to teen sexuality and students that are reporting in middle school and high school that have ever had sexual intercourse. So in middle school, we do have some improved data from 5 to 6%. Well, I guess that's not improved. Let's say from 8 dropping down to 6% in a 3-year there. And in high school, in 2012, we had 41% reporting have ever had sexual intercourse, and that dropped to 34%. So hopefully those statistics are moving in the right direction. Again, the second part of that, we're not seeing good numbers. However, those students that report having used a condom during sexual intercourse. And as you can see, in 2014, well, it dropped from 71% to 53%, and in high school, dropped from 63 to 61%. Obviously, that might have a lot to do with our teen pregnancy rate and our sexually transmitted disease rates as well. Low birth weight, that's a big indicator of, yes. Commissioner Rice.
Let's back up a little bit. On the infant mortality rate,
Yes.
I suspect that doesn't include abortions. Is that correct?
Infant mortality rate,
Right.
no. These are babies that are dying shortly after birth.
Okay. All right. Is there any data in regards to abortions?
Yes, I think Commissioner Rice, I think you asked me that question the last time.
Yes, I did.
And I did share with you those rates, but a lot of that is involved, I mean, it's a formula, but we can get specific data on abortions. I think that generally your question is, how does that affect our teen birth rate, if I'm not,
Correct.
yes.
Right.
So,
And as I listen to your objectives here, and obviously there's a lot that's been put into this, but I also believe a lot of this potentially is subjective to, I'm not really sure what percentage of feedback you're getting back on your survey year after year. Is the same people being surveyed? So for instance, are you getting back of everything that you send out, are you getting back 7% people responding? I mean,
the sampling, it's the
Yes.
community health assessment, are you speaking, some of the data you're talking about in regards to teen pregnancy and some of that it's vital statistics data, so that's reported directly from providers to state databases, so that's hard data. From the community health assessment, the most current survey that I provided a lot of data to you on.
Correct.
Yeah, that data is a sampling. As I said, it's about 1,700 and some odd individuals that took that telephone survey. So it would be, self-reporting, yes.
okay, thank you.
Uh-huh. So looking at the low birth weight data, and that we have gone from, I would say, even though the arrow is showing a drop, if you look at a trend, 8%, 9%, 9%, it's kind of leveling out there, but obviously low birth weight is an indicator towards infant mortality. So we want moms to have good health care during their pregnancy to ward those numbers off. Percent of sexually active females 18 to 44 that receive reproductive health services in the past 12 months. This is a new question and a new objective for our community health action results. And 40% of females received information on reproductive health, but only 4% of males. So a huge disconnect there, because obviously we need males and females to both have good information. Some of this data here is really just vital statistics data that we're looking at when it comes to heart disease, cancer, chronic lower respiratory disease, and stroke. Those are leading causes of death for our community, and it's based on a rate per 100,000. And I'm going to apologize because as I looked at this closer last night, I can see that the 2014 data is inaccurate. This is data, like I said, from Vital Statistics. We wouldn't even have that data. It's everything checks out okay, but I'm going to tell you that the 2012, the column for 2014 should be 2012. That is our most current data. And our heart disease rate in 2012 is 209. Oh, I must have hit a button down. Okay, sorry, wrong slide. So leading causes of death, heart disease, that rate is 209, so that is obviously going in a bad direction there. Our cancer rates for 2012, that last column, like I said, should be 245, so again, that is climbing higher. Our chronic lower respiratory disease is 57 for 2012, so that's pretty much remaining stagnant. And then finally, our stroke rate is 50 for 2012, so that has climbed up from 44 to 36 to now 50, so that's increasing. And then we also have some, oops, I'm so sorry, I'm hitting the wrong keys. So our age-adjusted rate of cancer mortality in Jackson County, this is community health assessment data, and we've actually decreased for breast cancer, or I should say a negative trend where it's gone from 24 to 29, colorectal cancer from 16 to 14, lung cancers from 57 to 69, and I'm sure that has a lot to do with our smoking rate. And then prostate cancer data is just, our first baseline is 24.2. And then the chronic disease, percent of Jackson County residents that indicate they have been diagnosed with diabetes, and this is a self-report, again, Commissioner Rice, from the Community Health Assessment data, and that was 11% in 11 and moved to 14% in 2014. Those that indicated they have been diagnosed with heart disease, that went from 12% to 5%, and I kind of find that as alarming. You know, I wouldn't have thought that had dropped like that. And then the high blood pressure moved from 38% to 40% reporting for 2014. And we're winding down here. Percent of women age 40 and over in Jackson County that have had a mammogram within the past 2 years. That went from 81 to only 73%. Adults that have had a colorectal cancer screening in the past 5 years, that went from 62 to 55%. Percent of adults that have had a cholesterol check within the past 5 years, 34 to 36% there. And then we went up in the annual checkup in the past year, went from 71 to 82%. And then access to care and preventive services, we've pretty much remained the same there with those that have had a blood pressure check within the past year, so that's pretty good, 94% and 92%. Diabetes, adults that have had a diabetes screening, that moved up to a little bit, 11 to 14%. And then we did drop here Jackson County residents 50 and over that have had a blood stool test utilizing a home kit, and that went from 54 to 44%. And then access to preventive care services, there's data there showing that the percent of Jackson County residents that report having teeth extracted due to tooth decay or gum disease, and you all know we have lack of good dental care adequate for our community. That went from 45 to 52%, but from 2008 to 14, that's stayed pretty much the same. Difficulty accessing dental care went from 23% to 19% are having difficulty, but it was 16% back in 2008 there. And then percent of Jackson County residents that reported cost as a barrier to accessing dental care for a child, and that pretty much stayed the same at about 9% in 8 to 9% in 14. We had a slight drop in 11. Let's see, let's go on down here. Immunizations, this is important. I'm sure we're hearing a lot in the news about measles at our great fun park out in California, and I think that's now over 100 cases throughout 15 states. So immunizations are crucial. And the percent of children aged 19 to 35 immunized with all their immunizations. To finish this up. There we go, thank you. That we're at 78%, and I will say statewide, we're doing very well there in comparison to many counties, so we'd still like to see that increase from 78%. And then percent that have received the flu vaccine in the last 12 months, that's pretty much, 39 to 49 to 39. We'd really like to see that go increase. So, again, these are the outcome areas that we looked at today. Don't need to read those to you, but the next step really is to update the priorities within our health action teams that, I've spoke to here. And we look at, when we do that, we look at all this hard data, and we also look at the results of what we're doing with our system scans, where we're doing some root cause analysis of how to get the work done in the best way that we can here in our community. And then we do prioritize the criteria based on objective criteria and subjective. So we look at things like the magnitude of the problem, how it affects our most vulnerable populations, the root cause of the problem, the severity. And then we also look at our community's capacity or willingness to actually act on the issues, because if we're not going to act on them, we're not going to spin our wheels and waste time and energy. And we also look at our ability to measure the impact on the issue and what type of resources that we have available to make an impact. So, thank you. I know this is a lot of information. I know you have the report, but I think it's really important that we understand how it plays out for our community and what we, your Healthy Communities Strategic Implementation Team, are doing to help improve the community of Jackson. Any questions? Thank you.
Michael?
Rick, facilities, works project.
Good morning, everyone. We're going to fire up Elmo for this presentation. It won't be as...
Let's close down this one. Okay, she's on whenever you want.
Okay. All right, good morning. Can you see? Okay. Back in 2013, we developed a budget to address the clerk's office, specifically in needs of modernization and upgrading the layout in that office. We put together a budget of $150,000 for it. We were scheduled to do this work in 2014. As everyone knows, though, the 911 project came along, and that took precedent. So in the meantime, we were working in the background at the clerk's office, developing the costs and trying to be ready to move once we had finished the 911 project. A little bit of background here. Prior to 1998, the clerk's office used to be located on the 4th floor of the courthouse. And then when Chief Judge Smucker went through and started his consolidation proceedings, bringing probate from the 12th floor of the Tower Building and the juvenile probate judge from the juvenile home all into the courthouse, well, the clerk's office was relocated to the 1st floor, and that's where the front of the court used to be. The front of the court, being displaced, ended up in the Woolworth Building. And then, out of necessity, the probate file department was literally stuffed into the east side of the clerk's newly created office space. So again, ever since I've been here, it looks like the proverbial, we put 10 pounds of stuff in a 5-pound bag. And we really wanted to address this issue, and that's why, in conjunction with the clerk, we wanted to remodel her office area. So fast forward into 2014, we brought in an architect who studied the floor plan, brought up some really good points. If we're going to be addressing the clerk space, we should also address probate as well. They're co-joined, but yet totally separate departments. And then during that exploration state, we examined the electrical distribution and basically the air conditioning system. The clerk's office is one of those areas where in the winter when we're running the heat, we also have to run the air conditioning. It's just the way the system was designed back in 1998 when they put the air conditioning units in. So to alleviate that, we're going to have to install new units. And with the new units, we also take advantage of what's called free cooling. We'll be bringing in outside air on cool days where you don't necessarily need to run the air conditioning. So it's really going to help in that aspect of energy efficiency, and more importantly, Amanda's election coordinator won't be sitting back in her office literally wearing shorts and a t-shirt. It's typical of our buildings. These are old buildings. They were retrofitted based on need, not without any type of a central plan. So where I'm going with this is, once we start getting our numbers in, just to deal with the HVAC and with the electrical upgrades required by code, we're close to $100,000 out of a budget of $150,000. Based on that, we went ahead and priced out the rest of the project. So I could stand in front of you and say, this is what the cost is going to be, and not have to come back here again and say, oops, I need more money. So what I'm asking for is to carry over monies from the 2014 capital improvement project, reducing the courthouse HVAC controls budget by $79,000, circuit court administration upgrades by $18,548, and then unused building contingency from 2014 for $49,086, and using some of the courthouse building contingency for $25,000. So I'm open for any questions.
If I may, whoever's running the meeting. I see a reference here, Rick, to the courthouse preservation fees. Is that the same as the Justice Center funds that we had?
Correct.
Okay, thank you.
Sir.
So from what I read here, you've got all the money reprogrammed from other areas, and we're going to get the clerk's office up to a little bit better standards than what they're operating in right now, correct?
That is correct, sir.
Okay.
Thank you.
Next up, we're going to have a discussion about 2016 budget. Do we have that we can put up, Adam? While Adam's putting that up, let me just start with a preamble here. Clearly, we're a long way from the 2016 budget needing to be adopted. I think legally it has to be adopted before the end of 15, obviously, so we can do it in December if need be. By and large, the budget is complete in the sense that it's been input. We've been done the crunching and put the information into the system. The challenge that remains is making it all balance. That seems to be the challenge. The challenge we've had for, back since 07 or something. It just continues on. We've come to the conclusion that, in reality, we don't really believe the county is going to ever overcome this by revenue growth alone. At least not in the short run. For that to happen, we need to see significant increase in development, if you will, new construction. Because with Proposal A and Headley, our revenues can only go up by 5% or inflation, the lesser of the two, which, dare I say, almost never keeps pace with just health insurance alone costs, let alone the additional costs of supplies and labor costs and so forth. So what it really comes right down to it is we have to either increase taxes or cut our spending. Well, increasing taxes really isn't a viable option. It's not like the folks in the county have a lot extra dollars. Their revenues aren't going up either as far as salaries and so forth in any significant way. So really we're proposed with $1.5 million deficit. Our practice has been, generally try to cut half of that and take the other half from our fund balance. Our fund balance is in excess. We are 24. We're at 27%. Really close to that, anyways. About every percent is about $500,000, and the high end on our reserve should be about 24%. So we're a little over that. So we do have excess there to take that cut again. But if we were to use all that money, that just puts us up basically 1 year from now. And actually, it's not even a year from now. Because under our new budget model, it's really this summer and fall that we'll be working on 17's budget. So it's not like we even get to delay it that far off, if you will. So in reality, if we don't do it in 16, we definitely have to do it in 17. Which is difficult. I mean, I can't overstate that. We've been cutting now for years, so it's not like we have a lot more supply lines or something like that we can cut to get to where we need to be. I don't believe there's fat left in anybody's budget, frankly. Most of the departments have a lot less staff than they've had in the past. Granted, we've had some technological gains, and that creates some efficiencies, but nonetheless, some things, in fact, probably most things at the end of the day that the county does is people-based. It's not, you can't do technology and when you still have to have that interaction, be it with Department of Aging or FOC or whatever it is, courts, it's still people-based. So you can only reduce so much there. Which really brings us down to this chart we put up here, and I know it's hard to see. Of course, most of you have it in front of you on your computer, so you can see it a lot better. And literally what we've done here, and you've seen this in the past, or some of you have, is we've said if it's costing more than $50,000 a year, let's try to record it on this chart. this graph here. At the end of the day, we need to, and the board's going to have to decide, do they want to try to cut it all, 1.5, or do they want to cut half this year and half in 17? But like I said, 17 is coming up this summer we'll be working on. So, you know, you have to, you know, either way you get there, it'll still be coming up really soon. We've met with most departments. There's a couple still we believe we need to sit down and chat with some more. They understand, you know, the process. It's not the first time. But again, like I say, it's I don't want to overstate it or understate it, but we've struggled with it in the past, and the struggle gets that much more difficult because now, in my belief is that we really need to make a decision on what program or service are we no longer going to continue. I know last time we got to that point, we had to make some cuts and some changes, and it was difficult. I think we ended up only having to basically eliminate animal control at that time. We may, well, I personally believe we're going to have to eliminate something. What that is, we will look at them all closely, talk with everyone. We'll apply the board's priorities and goals that they have established. Of course, you'll have an opportunity to weigh in on all that. And at the end of the day, the board will have to decide if they would agree with recommendations of staff or if they'd like to make some modifications. What is not acceptable is to just keep kicking the can down the road. Like I say, we have a year or two, but after that, we really start dipping into our reserves. And some people would argue that, well, you have reserves. That's what reserves are for, to dip into. Agree, but yet at the same time, if you think of your own personal finances, if you receive a paycheck once a year and then have to budget from that paycheck, come the end of the year, you're probably looking kind of lean. May end up having to borrow money. We're not even close to that, but if we start dipping into our reserves, we could find ourselves in that position. It's not necessarily uncommon. It's not uncommon from the past when a lot of communities issued tax anticipation notes and things like that and paid them back off when the taxes came in. But that's not a healthy position to be in. So basically, I just wanted this out there so that everyone can see where the money is, where the bulk of it is, and you can see from all these little departments that are, 100,000 here and there, you have to cut a lot of those in order to, totally eliminate them to even get close to 1.5. So some tough calls ahead. Any questions, concerns, or otherwise?
I'm looking at the truancy grant for $94,000. Is that money going in or coming in or going out?
It's all money. These monies here that's listed, these are all general fund dollars. So while there may be some grants and so forth that would be a part of a department, we're trying to look at here, identify what is the general fund dollars. And while you bring it up, you notice on there's mandatory versus non-mandatory. The thing to say about mandatory is we have to provide the service. But the Supreme Court has declared or ruled that we have to provide the service at the minimal service level. Now, obviously, we don't want to necessarily be at the minimal service level. It's not a pleasant place to be. But legally, that's where we can go. So ultimately, what I'm trying to say is, while it's mandatory, doesn't mean you cannot reduce it. Doesn't mean you can't trim it further. Of course, the things in blue up there are non-mandatory, but at the same time, we need to recognize that while it may not be mandatory, it most likely, well, I shouldn't say most likely, but some things are essential. So we can argue that IT is not a mandatory service. But when your computer stops working, it will become essential very quickly, since that's how we function these days. And the same thing with facilities and right on down the line. We can argue that, we can cut maintenance. Well, when the furnace goes out or when something breaks and we need it replaced, it gets to a point, you move to a different room for a while, but eventually it becomes essential. You run out of rooms. So we need to be cognizant of that when we are making these adjustments.
I just have a question on the grant situation. I know Phil was just asking about it. Can we get a breakdown of what that actually is in real dollars? Because I understand that we put, like, say we give 94,000, but how much does that actually affect their budget because of matching grants and all that? Is there any way we can get a breakdown of that to see what the true dollar amount would be if we were to have to reduce that?
Yes, in fact, we've discussed that as well, because while you may cut a program that is, we're spending $50,000 on, it may have matching grants of another $50,000. So in actuality, the effect on the community is double what we think it is. So we're working on that as well. Thank you.
Well, not to belabor the point, but is that factored into these numbers? For instance, the truancy at 94, if they have a $50,000 grant, for instance, is that on top of this 94, or is that factored into it?
None of those grants would be factored into this.
So these are actual dollars that come from the general fund?
General fund.
Okay.
Yes, and again, we're going to have some other charts to show and so forth that'll show you, here's general fund, here's the total budget for this program, and what we believe will be the implications if you were to change that service or reduce it or eliminate it altogether. And with that, we'll of course make sure we have the appropriate department heads and so forth in the audience, because no one knows the programs like the people in the front line delivering it. Yes, sir.
I was just curious. Excuse me. I was just curious. I just noticed that the airport was listed twice.
Yeah, what it is we have there's different programs and different aspects. In fact, we've combined some, but you'll see a number of different areas where it's like that. I know, I'm just thinking of some of that we combined, like the prosecutor, we combined some of their line items too. It's different pools of money, but at the same time, it still works out to be general fund dollars here. And we're going to do some more tweaking on this to make it, we'll say, more clear. Adam, you have anything you want to add to this? Any additional questions or concerns? Obviously, this is not the first or last time we'll be discussing not only this chart, but others. But I wanted folks to start thinking about it. As you recall, last time we had considerable conversation. We had a considerable audience. Each group, if you will, in the audience had different concerns in regard to their particular program being eliminated or reduced, and the implications thereof. Yes, sir. Then Phil.
I have a question that I need to have a better understanding of, and I think maybe some of the other commissioners too. You have Lifeways as a blue. I thought we were required to pay all of that.
I would agree.
I'm good. Oh, I do.
Phil?
I think it's 2017 that we're looking at the tax on our health insurance required by the Affordable Health Care Act. Is that correct, 2017?
I think it's 2018, January of 2018, unless something changes. Obviously, we need to, we need to be prepared to pay 40% more or reduce our plan. And our contracts will all be due at that time again, so you can imagine what our position is.
40% more on retiree would be $1 million, doesn't there? Just on retiree health insurance. I don't see active employee health insurance.
Yeah, in fact, that's a good point, Phil. I would point out, there are some things that are not in here. If you were to add all these down, they don't necessarily add up to what the budget would be. One, there's a whole lot of small departments, less than 50,000, that are, I don't want to say inconsequential, but at the same time, you really have to take out a lot to get anywhere near 1.5 million. In addition, there's other things that are not in here, like property insurance. We don't really have a choice. We have to pay our property insurance and casualty and some of the other programs that we have.
Yeah, I'd like to be perfectly clear. I don't want to be thought of as reducing health, or retiring health insurance. I was just figuring the 40% based upon the figure listed. I'm not advocating that.
Okay, thank you. If there's no additional questions at this time in regard to budget, just know there's more to come, and a healthy discussion will be had, I'm sure. With that, we'll move on to our remaining item. We have a road presentation by Christopher.
Thank you very much, Adam. Good morning. Well, thank you very much for allowing us to come forward and present once again to you. We're very happy to be here this morning on the heels of 12 to 14 inches of snow here the last 48 hours. I have with me today Bob Griffiths, our Director of Operations. If you'd stand a second, Bob. Thank you. And if you have any questions of a technical nature and so forth, I might pass to Bob, because I do have a wonderful team that I work with to help everything become reality. All right. We were planning to actually have a couple more of our key people here this morning. We've had a series of workshops in recent weeks, but due to the weather circumstances, we decided that would not be a good idea. We have a lot going on right now, so they're basically holding down the fort for us so we could be here today. We view, just to say on the front end, that Mother Nature requires us as an agency to respond in an emergency fashion. I don't think that's a surprise to anyone, but in my recent discussions with staff, I constantly use the fire and the fire hall type metaphor to explain what we do and why we do it. There's a lot to this, but we're going to try to share just some key information with you this morning, and I'm sure there will be some questions generated, and I welcome the opportunity to answer those by email or at the end of our discussion today. And please know that what you hear today is basically our current policies and practices. We are carefully reviewing everything we're doing right now and having a series of discussions and even debates on what we can do feasibly with our limited funding resources. What we used to do years ago, which is what our public sometimes expects, we're just simply not able to do today. We have the smallest staff in decades and diminishing resources. So we're trying very hard to work smarter and do things better. So moving forward here, we'll cover an introduction on winter storms, and we'll talk a little bit about our driver's perspectives. I have a couple videos in there that hopefully, if technology works, we'll be able to view those. It's one thing to watch a snowplow go by, but it's another to actually sit in the cab and see how it operates. So I may be able to email those to you if it doesn't work this morning. And then we'll cover some training and safety issues, and we'll talk about our response to storms, current policy and protocol, and then we'll just cover some highlights on technology and innovation and some of my vision in working with Bob that we'd like to implement in our department. All right. Well, these are my hands on the crystal ball. No, I'm just kidding. But predictability is a key. Snow accumulation is a factor, ice formation. There's so many rocket science type issues with what we have to consider. Ground pavement temperatures are a big factor. When the ground is warm and we get just even a light snow, you kind of get a a slippery formation, and then it freezes. And you get the sunshine in the day, which melts, and then at night you get the freezing again, which makes things slick. So we always have to think about pre-storm, during the storm, and post-storm. And then you have winds, temperatures, duration, timing, and other factors. Our storm response protocols are in place, but it's important to know that every storm is unique, and we constantly watch and customize. It's similar to, the Super Bowl game, and I liken it to sports quite a bit, where we constantly have to adjust and go back to the playbook to figure out what to do. So, find the road. It's kind of like, in this type of situation, all you have to guide you is essentially some trees and some mailboxes, and if you're lucky, some former wheel tracks. And then try to do this at night. And then here's what the driver sees. And try to do this at night. And we usually use pretty high-class wiper blades, don't we, Bob? So we do the best we can, but you know how it works with freezing conditions on your windshield. There's an art and a science to it that, they master over the years to make sure to not miss any. And we're going to cover that in a minute, too. So here I'll get to see if my video works. Not sure if... Here we go. Oh, says QuickTime not available. Darn, that was going to be a real treat. Is there a way to get QuickTime? Probably not. Or plug an iPad in or something like that. I've got two videos, actually, and I'll just... Actually sitting in the cab watching the snow drift and blow up over the cab, and here you're driving, 30-some tons of vehicle, 20 to 30 tons of vehicle. You do? Awesome. So should I just close down and plug into you?
Oh, wait, let's see. I have the PDF version.
You do have the PDF. I can give you the jump drive if you'd like real quick, Adam.
Yeah.
If I can escape out.
Escape that, save it to the desktop.
Okay.
Save as.
Just put it out here. There you go. Thank you. Wow, you even got sound.
Well, we'll see. Sometimes it doesn't work great. The sound. And do it.
Take out your Logitech keyboard thing if you need to.
Yeah, that one over there always has me. Yeah, it's finding it.
Okay. If you'd like, I can continue for a moment while Adam's trying to load that. Am I still on the monitor until you switch over? Yeah? Okay, great. So we'll come back to these next couple of slides here. Mailbox damage is not typically caused by direct hits, contrary to popular myth. Is that right, Bob?
Yes.
So here I have some photos, and I'm a huge photography buff, so I sometimes, especially on weekends when I don't have office work to do, I pack up my SLR camera and I head out and try to get our crews in action. These are not our crews, but they are some photos that I personally took. Are we good? Okay, I'll come back to this, I guess, in a moment. So how do I switch over to? Okay, super. Yeah, whenever you're ready. Thank you. So it's now on this? Okay, so this, if I hit play, it should work. There we go. Are we seeing it? Super. This is not, actually, but I have a video of one of our trucks, but I couldn't get it orientated right, so this is one that I took a year ago, actually. We certainly don't want our drivers videoing while they're driving, so. You got a lot of loud noises. Cabs are very noisy. You can see very much so that the trucks are having to feel their way with a lot of cues. You might think when you see a big truck pass by that they're up high, they can see things, but clearly with snow blowing and the plows.
Were those mailboxes stuck on the corners of the truck there?
Yeah.
I'm kidding.
All right, here's another one. I think I have two. And there we go. And actually, as I was shooting this video, we hit a drift, and on the hood of the truck, an entire plop of snow blinded the windshield, and his wipers got stuck. So, of course, I didn't have the camera running then, as Murphy's Law would govern. But here you can see garbage can and mailbox, and he artfully just grazes by. He knows the feel of his truck and the space. Here he's actually got some decent visibility for once. And this is all daytime. So again, trying to do this at night is definitely a challenge. Thank you, Adam. If you'd switch me back. All right, wonderful. Nope, that's it for videos. Thank you. Can I take this out? Okay. Appreciate that very much. All right, so mailboxes are one of our biggest problems. It's actually, if I was able to back up one slide here, see if I can. Here is and you know, on my camera, I'm able to hit the button and take a bunch of sport action shots in quick series. Here comes the plow. You see the mailbox there. He's not going to hit it, but the blast of snow from the blade. And remember, even from the video, we were going like 10 or 15 miles an hour at the most. So this is not moving that fast, but the plume of snow, the way the plows are designed to shuffle it off, it sends quite a force of snow. So any mailbox that's half loose or is close will get hammered and potentially damaged. We do sometimes actually hit the box, and you can often tell when that happens. But here is again from a passenger seat perspective as the blade approaches a mailbox. And we graze right on by. So again, this is daylight when you can see things. Try to do this at night. It's not surprising that we're actually going to hit a few or that the snow would damage. Garbage cans are another obstacle that we face. Sometimes we get one and tip it over. Okay, training and safety. This is an actual shot from last year, January 7th, 2014. This was in Parma area, was it, Bob?
That was in the Parma section.
Yep, in Parma. Accidents do happen, hazards abound. Remember, our big trucks are driving around in hazardous winter conditions. Here's a shot from Calhoun. And as I was saying earlier, it's part art, part science. Our operators are highly skilled, and I have to say I'm very proud of what they do. I think Bob can say the same. Bob is a plow driver who has moved up through the ranks in our department. Not just any truck driver can plow, by the way. Just because you have a CDL and you can do over-the-road hauling, when you put someone like that in the driver's seat, there's a lot to learn. It's a very highly specialized niche. Here's a couple more shots of recovering one of our trucks. Operator fatigue is very real, and it's a concern in our industry, especially as this last winter and in events just like we've had. People often wonder why we stop plowing towards 7 or 8 o'clock at night. We have been out generally, as we were yesterday, since 3 o'clock in the morning, and those drivers have been going. Imagine yourself on a trip, and all you're doing is stopping for potty breaks, doing that for 12 to 16 hours. And if you get a sense from the video I showed, you're jostled around in the cab, it's noisy, you don't have a nice fancy stereo, sometimes the heat is questionable in some of our older trucks, so you've got cold feet, poor visibility, your adrenaline's pumping, and you know what happens after hours of adrenaline pumping is you wear down. So it's a real consideration, and for safety reasons, and I have had, the misfortune of being involved in some accidents and lawsuits where drivers were tired. So we take it very seriously and we carefully assess the attentiveness of our drivers to make sure we're safe. So here's some information on our policy. In a general overview, and you don't have this slide in your presentation, we just got this information hot off the press. We wanted to make sure it was accurate. We plow a total of 1,863 centerline miles, and lane miles are basically just that. So when you have double lanes or 4 lanes, because it takes a plow to run a lane, so you really have to look at lane miles. That's 3,700 lane miles. So state highways, here's how it breaks down: 280 centerline miles, 544 centerline miles of primary roads, and 1,039 of local roads, includes subdivisions and gravels. And out of that, 239 is our gravel road breakdown. That's a lot. It's a lot for our staff to handle, especially when you want to clear it in 8 to 12 to 14 hours, especially when you have heavy snowfall. So here's the thing on our winter response. Storm event responses are planned and orchestrated. They're customized by each event. And we have a governing winter road maintenance policy and procedure. You as commissioners did not set that. Our former road commission board did. The last revision we have is November 17th, 2010. So it's time to take a good look at that. And a lot of county road agencies in the last decade have basically revised their winter maintenance policies to address the funding crisis. So what that means is they basically minimized or cut back on public expectations to clearly state that it's not a bare pavement policy, that they're not going to get to subdivisions on the first day necessarily. They're trying to set some criteria on inches of snowfall to decide where they get when. So we are currently looking at that to see if we can do better, and everything is going to hinge, of course, on May's vote with road funding as to what we can do in the short term. So in looking at our vision statement and our mission statement, I'm a big fan of pulling our people together. Here's a shot of one of our committees studying an issue, and you see a shot there in the lower right of our whiteboard results on how we handle this. We basically just mind map it and lay it out in a visual fashion. I have some close-up shots here in a couple slides. So we set things up by 6 priorities. And priority 1 is our interstates, priority 2 is our multi-lane county primaries, and then it goes on down to gravels as the last. And here are the details on how we handle each. So here's an overall map that's provided to us by MDOT, and I have another one that shows highlighted marks what we are responsible for. We have orange routes, which are the interstates and the U.S. highways, and then we have to, by contract, basically provide bare pavement over the entire width of those roads. And 24-hour coverage is mandated, and we use overtime as needed and as directed by MDOT. We do get reimbursed for that time and energy, so just wanted you to be aware of that. Level 2 is what we call the blue routes, which are the M routes, Michigan State Highways. And we try to provide our mandate essentially from MDOT is one wheel track in each direction. And pavement is to be cleared bare over the entire width as soon as possible without working overtime. So these are state budgetary constraints because they're paying us to take care of the roads. We have to just basically follow orders. So here's a close-up of Jackson County and our surrounding vicinity. We actually go beyond our borders. I'm not sure if you're aware of that. Here are some criteria that's provided to us. And there's the highlighted routes. I hope you can see those okay. But we actually go south quite a ways and even to the east. We are one of 60-some county road agencies that has a contract with MDOT. Not all county agencies do. And it is a real blessing. It provides us with leverage, equipment, and manpower resources that really help to provide an enhanced service to our primaries and locals. All right, so from priorities 2 through 6, we do have a system. And what I have here is a quick shot of one of our snowplow route books. In the next few months, we will be moving towards electronic access to those maps so that we can quickly pull those up and customize routes and train drivers. So these were developed over years of trial and error. They are carefully orchestrated, and they are somewhat tuned in and more complicated than they first appear. There are many nuances to why drivers go where they go. Here are a couple sample maps. This is Allen's route in our Clark Lake area. And then we go to Doug's route. We have color keys to the various types of road and what priorities they are. And then here's just some close-ups of our workshop. You'll see some clocks that I've drawn up because we wanted to really nail down when we go in, how many people we have. I know there's a lot of scribbled details in there, but if you have questions at the end, I can circle back to this graphic and show you. But basically, in a storm event like yesterday, we have a night crew on duty. We had Sunday night, we had everybody out Sunday, by the way, and we called them off around 3 p.m. And then the state crews continued through the night. Do you want to address that, Bob, how we did this last storm? That's a good example, if that's okay.
The state crews are out 24 hours a day, like you said. So basically we have to split them in half. There's two guys for every route. So I-94 East has 2 guys. One works days, one works nights. And then if we need to, we run them 16 hours and they overlap in the center. So they can run together for 8 hours, and then each of them have 8 hours on their own. And they just keep that cycle going until the storm's cleared and we got it cleared up. As far as the county routes, we normally bring them in at 3 to 4 in the morning, work them until 6 to 7 at night, and that'll get them their 8 hours of sleep thereabouts to come back in at 3 or 4 the next morning. So we pretty much run everybody as long as we can, keeping the safety factors in mind, and not working them too long. But
Thank you, Bob. Something we're trying to do is at least get a first pass through subdivisions and gravels before we end that first day, if we can. So yesterday, we were able to hit, we think, everything. We did get a couple complaints, correct?
I think we did hit everything. I've got 2 that we're checking this morning, just to make sure that we didn't miss them or that they weren't old complaints. But I think we at least got a hole through everything yesterday, and they're out cleaning up today.
But we
Question.
Yep, go ahead.
You're running 16-hour shifts. We've all been driving ourselves on trips and so forth, and, it's, after 10, 12 hours, I start to get a little fuzzy. I think everybody probably does. How many hours are they actually driving on a 16-hour shift? Because, that's pretty nerve-wracking and intense, I imagine, at times.
To be honest with you, most of the guys don't take many breaks. They stop quick enough to eat, fill up, use the bathroom, get something to drink. But a lot of them are out there driving at 12 to 14 hours easy on any given shift, on actual driving.
Other than fuel and, quick rest. Yeah, so it's nonstop, basically. Like the Indy 500, essentially, with pit stops.
Bob, are you guys exempt from the federal DOT laws?
We have exemptions up to that 16-hour mark, but yeah, for emergency conditions, we're exempt. And we try not to go over, I guess technically we could go over that 16 hours, but just through years of, court cases and stuff like that, that's usually where the court draws a line saying, if you work them above and beyond that, they're probably going to find you at fault.
Thank you.
Yeah. And that's a very important question because as we look at staffing needs, winter maintenance or emergency response is basically the governing factor. We try to staff ourselves to fit that need and then find work the rest of the year, which there's no shortage of, to fill the gaps.
Chris, there was a time when we were looking at GPS tracking software and a program to assist. Is that still being looked at, or?
Absolutely. That is something we must have as a tool. It's becoming more and more common, and the pricing is coming down quickly. We are in the process of getting RFPs. I think they're due today or this week. And road departments go in two avenues with that. One is a cell-based system, and one new developing technology in recent years is radio-based, which you put a GPS antenna and it feeds through the radio, and as long as it's digital radio communications, it can send all kinds of information, blade up or down, salt sander on off, vehicle speed, all kinds of things that you can hook up to a special black box that transmits by radio, and then it's free forever. You just buy the system because radio doesn't have a monthly cost. So that's the system that we're looking at right now closely, and we're expecting to get some pricing here shortly.
Will it tie in with the 911 or the county police radio system at all, or beneficial to tie in with that, or consider it or not?
We've talked with them. They're not on a digital system, which is what ours would require. We have a great radio system. We have partnered with them over the years, but they're on an analog system, and there are good reasons for that, actually. So the cost benefit on a digital system is it pays off quickly because there are no monthly fees. So we could go down the avenue of keeping our radios and having the cell-based system, but the fees are nearly 6 figures per year to have that. Depends on what kind of features you want. I know Calhoun pays about $30,000 a year for a basic system, but if you go over to Kalamazoo, I think they're up around 100-some thousand per year for theirs. So we're trying to find something that's cost-effective and yet a great tool. And other counties have already piloted this radio-based system with great success, including myself. I implemented that in 2 counties as well. So yeah, you'll be hearing more about that actually in the next month or two. So generally, overtime is limited to multi-lane and primary roads. I think we've covered a lot of this already, but our current policy, just for sharing with you, I think it states 10 inches or less, doesn't it, Bob? And we've changed it and brought it down to 5 or 6 inches, as shown here. Actually, I have it here. So these are some of the things. We don't actually go by the 10-inch criteria, but I think the Board of Road Commissioners, back when they last amended this, they were trying to, again, set something they could afford to provide. So we actually practice with a lesser criteria to provide enhanced service. All right, so lastly, some exciting things, technology and innovation. No secret, based on last month's discussion, that we're facing declining funding and staffing. So we have to leverage technology, and we have to seek innovative ways to improve what we do. So some examples of technology are just simple things that have really developed. For example, automatic transmissions are a lot more robust than they ever have been. Imagine driving the truck with the visibility issues you've got and then trying to shift manual gears. How many manual transmissions do we have now, Bob?
Probably about a quarter of our fleet.
So we've got about 25% of our trucks right now that are still manual. And, they often joke that a real truck driver drives a manual, but today's automatics are quite amazing. Do you want to say anything on that?
Yeah, a little bit. With all that's going on in the cab, there's also not just shifting, but you've got 6 to 8 different levers that you're operating, 3 different style plows, your solder, your liquids. So there's a lot going on in that cab that taking that transmission equation out of there helps the drivers a lot, helps their ability to, go a little bit longer, be a little bit safer. But it costs a little bit more for the transmissions, but in the long run, I think it's worth it. So all the new trucks that we're getting, we're trying to put the automatic transmissions in it.
Exactly. Thanks, Bob.
Bob, is that a conversion to automatic transmissions? Because I know we talked about framing and everything last year, at the end of the season, and getting those rigs that we were going to be able to take apart and put back together quickly.
Yes, we're actually in the process of that. all those are going to be automatic transmissions. The first one showed up the other day. We've got the rear ends rebuilt for one of them, so we're getting ready to put that together. It'll get shipped over to the builder to do the actual build for the dump body and all the plow blades and all the equipment that goes on it. So we're in the process of doing that, but all those are coming in with the automatic transmission that we'll install in it. We're not actually converting anything over, it's just, that's what's coming in it. Thereabouts, yes.
Yeah. These glider kits, as they're affectionately called, are in high demand. Basically, it's a way to build your own truck, customize it, but yet not have to buy into the new Tier 4 emission requirements of the diesel requirements from the feds. There have been a lot of hiccups in that Tier 4 emission technology, which, as you may know, is a real headache. So there are advantages to new trucks, though, and so we're carefully evaluating the wisdom and which direction to go, and it might be a blend of the two. So I think the ideal scenario is where we build 1 or 2 trucks a year with the glider kits, and we're also buying new, potentially even purchasing several at once.
Christopher,
Yeah.
at what point is that not going to be feasible? I mean, I imagine the emission standards aren't going to get any easier, and eventually they're going to say, well, no more circumventing our emission standards.
Exactly. That's exactly the question we're asking internally, and the day is coming, so there's this window, I suppose you could say. I don't know if you have any thoughts you want to share on that, Bob, but our mechanics, of course, are leery of the new technology. We've actually seen brand-new $200,000 trucks in the middle of a storm that shut down because of the sensors and snow getting stuck in the air breathers and clogging things up. So there are, especially in the heavy demands of what we do. So I don't know if you want to share some on that, Bob.
As far as the glider kits, the one limiting factor is we have to have the donor parts to build it. They'll come either powered or non-powered, so whether there's an engine in it or not, and really it's just a frame and a cab. We have to have or purchase the transmissions, the rear ends, the transfer cases, everything. We have to have an old style truck that stuff's still in good enough condition that you can pull it out of that truck, use it in the glider, rebuild it using the glider, and then salvage the remaining parts of that truck. But if you don't have those parts, it throws the cost so far out of range, you might as well buy a new truck and deal with the emissions. But at some point, we're going to run out of those trucks that are donor trucks, because the new trucks will be there, and that's what we'll have. But that's kind of the process we're doing.
Thank you, Bob. Okay, so moving on to some equipment innovations, which I'm excited about. I think our whole staff is. Wing plows are a big movement in the last few years. And our trucks, we have 4, I think, that are mounted. They're all, the state trucks have these wing plows on the side. Here's one photo. This is actually one of our new, looks like Peterbilt, correct? So these Peterbilts are real rock-solid trucks.
One quick thing on that.
Yep.
On the 4 glider kits that we are building, those are going to be built with dual wings, so they'll have a wing off each side, so the state trunk lines can handle whichever shoulder they need to and be a little more effective.
That's right. I'll show you a photo here of wings in action, where we've got, this is not us, but it is a good example of how the wings work, dropping down to the side and increasing the swath of what a plow can clear with one pass.
So they don't put both wings out at the same time, huh?
No, a wing can't go in a live lane of traffic. So,
Yeah.
Well, those look all lively behind them, that's for sure.
Well, that's a protocol where you can see they've got them staggered so that vehicles can't pass, but it is controversial, actually.
Yep. MDOT doesn't like us to do that. Just on this picture here, with this last snowfall, we've got the snow stacked to the wall, all the way out to the white lines now, so we're looking at possibly even Sunday, coming in at 1 in the morning and doing this exact operation to clear the snow off the wall.
Yep.
So it takes four trucks and a few, I see they don't have a whole lot of like buffer behind them where they've got, like, we'll normally call state troopers, or we'll have our trucks out there to slow the traffic down, but we also are mandated to do it like on a Sunday night from MDOT so that there's not that much traffic going anyway. But
Yeah, lowest possible traffic volumes and interference.
How fast are they normally going when they do that operation, typically?
Probably no more than 15, because that first truck up against the wall, he's got to kind of ride the wall, and you don't want to scrape it all the way down or you wear the blade off. So he's got to be careful, and there's catch basins over there. So that really drives the rest of them behind him. He's whatever he can take off the wall. There's
Exactly.
tires, car parts, you name it. There's it's in there. Hope not.
That's one hazard, are manholes and catch basins. That can stop a truck like this in its tracks and tear out the undercarriage. These trucks, here we have front plows on in this photo, but a lot of our basic, I guess, daily use is the underbody blade, which rotates, and you can actually apply down pressure and really scrape the road off, so they're great. But when you're doing that and you pass over a manhole lid that's just up maybe an inch or so, and you catch it, you're in trouble. So it's that's partly one of those costs we bear because roads aren't being, we're not able to keep up on maintenance of roads. Here's an interesting, I don't know if you've seen this, these tow plows. We had a meeting with MDOT, and that's where the double wings came up in discussion here in November. I think we were preparing for winter, and I gave the go-ahead to install wings on our new trucks, the double wings. But something we have tried before, have we tried this, or we're talking about trying it, right? Is the tow plow?
MDOT would like us to try it, but they're quite expensive.
Yeah, they would like us to try it. I think they want us to buy one. But basically, you pull this trailer, I'll go back a shot, and the trailer, you can see it in the normal in the upper left, the wheels rotate and activate, and it swings off to the side and grabs a large swath of snow. Basically, when you're doing this, Bob, isn't it true that this operator here has probably got his foot feed pretty much down to the floor to pull all that? So it's kind of like drag racing in a snowplow.
Yes, it does. It's got a hopper in the center there that'll apply salt just like the truck will. Yes. It kind of goes around, and they've even actually asked us if we want to try to use it on 94 time to time. But
We're going to try it. It's just
we
a
just
matter
need a
of...
high horsepower truck to
Yeah.
do it. The gliders that we're doing are, I believe, 475 horse, so they'll be the strongest trucks that we actually have in the fleet.
Indeed.
It'll actually deploy as quick as the wing. And so as quick as that wing will come down, that trailer will deploy out and deploy back to go through bridges, and a lot more to watch.
You can, instead of the salt sand mix in there, you can have a de-icing tank of liquid too. I've seen some of these with those. So we're keeping mindful of these innovations, and we'll keep you apprised of things we are trying. So just a conclusion here, our staffing is at an all-time low. It's one of our biggest challenges. We're basically down to bare bones. We supplement with 6 seasonals. So basically when we're all out, we've got 14 state crews plus 12 people per of our area garages, so that's 36 total, then plus 6 seasonals. And the seasonals are doing a great job this year. We got real lucky with a great crop of applicants, and they're doing wonderful work for us. Yes. Yeah, sorry.
You're talking about solutions to go down. A year ago,
Well, short answer, yes. Bob, do you want to address where we're at? We did have a workshop here recently exploring products, continuing to, and we're trying some of that. Go ahead, Bob, and explain.
On the state roads, we do use them and have used it for quite a while on all the trucks. They all have what we call a wet system, where most of them are spraying calcium chloride, 32% calcium chloride, directly onto the salt at the spinner, so it hits the salt, gets it wet, and the spinner puts it down. So our state trucks all run that. Probably about half and half of our county trucks have that capability. Some of the trucks just weren't purchased with it, and we don't have it. But that's the intent, is to at least have that capability on the new trucks that we have. We did talk to a company the other day that actually is a company that won the bid for the beet juice. We don't have the storage capacity or tanks to put it in, So he's actually looking at possibly coming to the garage, they'll bring their tanker, we'll pre-treat 1,000 tons of salt and kind of put it off on the side, so when we need to use it, that's what they'll dig out of. If we don't need it for weather conditions, they'll dig out the straight salt. But we are looking at trying to see how it works. Basically, that will lower, the beet juice lowers the freezing point about 5 degrees, so it doesn't give you a lot of leeway, but it helps on certain conditions, so.
Plus, it makes the salt sticky. Tends to stick to the road better. So our equipment is basically our major issue, and that'll be next month's presentation. We're working on a capital improvement plan and trying to put together details. We really are, just yesterday, we were down 7 trucks at one point, and we're still down 6. That's frankly not acceptable, especially when we're being called to duty. So we're looking at a variety of options, and we'll have some facts and figures to share. I don't know if you want to give an update on that, Bob.
We actually had, talking with the maintenance crew, we had 30 trucks go down during this storm. They turned them, got them repaired, got them back out on the road, where we've only got 6 of them that are what we'd call hard broke, waiting on a, transmission or, air system or something that we can't fix immediately. So they kicked out a lot of trucks in the middle of all that with froze up trucks, so the mechanics did well too, so.
And as Mike alluded to earlier, the kicking the can down the road, here we're just seeing, the harsh reality of that. We have not been able to keep up over the last decade plus with equipment replacement. So our fleet is aging, and the rules of thumb on how long you want to keep a truck are definitely not being met. And we're seeing increased maintenance costs, and we're also realizing, we're not realizing the technology and innovation savings that we've shown you here. We're not able to add that to our older trucks. And then funding, which you saw last month, we covered that in detail, is our major restriction. Thank you very much. I'd be happy to take any further questions if you have.
Carl?
Hey, Chris, not so much a question, just a comment, and I suspect any commissioner here could make that comment, but from my perspective, I was very impressed with what I saw out there on the roads yesterday as I drove around the neighborhoods, as you said, to pass through the first time. People getting up on a Monday morning and going through their neighborhoods and finding out that the snow was actually removed, which was quite impressive. Obviously, you got to the highways and main roads first, and there's always people who are going to complain, but all my comments I got back were good. I did get one complaint back. I made a quick contact with Bob. He responded. I responded to the residents. They're happy. Took care of it just like that. So very impressive. Just so you know, I did have an opportunity to ride last year for about 9 hours on the highway and then in the county roads as well. And I received a totally different perspective on how difficult it is for this job to get done. So again, and I appreciate the innovative ideas that you're working on as well. So thank you.
Thank you very much. And hats off to our employees. A lot of great ideas come from them, and we are doing our best to listen and give things a shot. So, do you want to add anything more or respond to that, Bob?
We're getting some more snow this weekend. There's always a standing offer. You can come ride in any of the trucks. We'll get you in a truck.
Absolutely. We'll make that work. Anything else?
Any more questions or comments? I think you guys have done an outstanding job.
Thank you
Like I
very
said,
much.
Typically, I get a dozen phone calls, I got one. And if you said you got through them by 6 o'clock, I'll talk to him later today and we'll see how well we did. And I think you've done a great job. I know one neighbor, Dr. Thyrogen, I know you talked to her an awful lot, and she's happy with the way you're plowing now. She's thrilled to death. So she's not having to pay to get her cul-de-sac cleaned out after we go through it. So that's a huge, huge difference.
Good. We do take complaints seriously when we get them. And Bob, you personally check out many of them and
I spent a lot of yesterday dealing with with just that. I was out for the first 6 hours clearing MDOT parking lots, and the rest of the day taking complaints and going, look, we had a few issues that we have to take care of, but all in all, I think it went pretty good.
I suppose a footnote to today's conversation is that we have 4 pickups, basically, that are equipped with plows, at least 4, right?
4 pickups and 4 brand-new one-tons that have a V-plow on the front of them.
You've
And
also,
those are what we're using for the cul-de-sacs and trying to clean up those little triangles that are in the center of everything. That's what they're out doing today.
yes. So our management team is basically out helping, and that's been a past practice that we are continuing. So,
We're very lucky that our union doesn't balk at using management to go out there and help in these situations. There's a lot of counties around that they just can't do it. Their union will throw agreements up in no time, and our union or new association always has been and is very good at, you know, if we need to jump in a loader or a truck or something to help out, they're like, you know, fine.
thank you all very much. You get us talking about something we're passionate about. We can't stop. Thanks.